that was going to work. All right. So if you want to bring those folks in, Dawn, we'll be ready to rock and roll.
Hello.
Hello.
Hello, gang. It's the doctor.
Do you want to talk? Dr. Yocum, good morning.
Yes.
Here's Bob.
To the miracle of technology, you're here with us. That's great. And Dr. Yocum, would you like to?
There he is.
There I am.
Very good.
I'll tell you, I love this video stuff.
I can tell.
Okay. Well, it was a year that was very forgettable. I've never had a year like this in all my years of being the assistant coroner and the head coroner. Everybody has my report, I think.
Yes.
Start out, this is from the year 2020. Cremations, as you know, we approve every cremation that happens in Lebanon County. We had 898. That was an increase of 126 cases of cremations. Moving on, the total deaths that we investigated last year was 497. It was an increase of 177 cases.
Wow.
Out of those 407 cases, 116 of those were COVID cases. And I'll get into the COVID cases a little bit later, but I'll go through the report here. We had a total of 61 accidental deaths. That was an increase of 20 from last year. Out of those 61, 35 of those were drug-related, and Jim will get into that later. That was an increase of 7. We had 17 motor vehicle accidents. That was an increase of 5. And we had 2 drowning cases. That was an increase of 1. And then an assortment, we have 2 falls resulting in death. 1 smoke inhalation from a fire. 2 cases of compression asphyxia. And 1 shop accident and 1 multiple force trauma. Then moving on to suicides, we had 21 suicides. That was an increase of 2. 12 of those were gunshots. That's the most common cause of suicides. We had 2 overdoses, drug related. 6 cases of asphyxiation. That was 5 by hanging and 1 by carbon monoxide poisoning. And 1 drowning. And then we had 3 homicides. That was an increase of 2 from last year. We had 2 undetermined causes, meaning after investigation, after autopsies, they could not determine the cause of death. Well, that was a decrease of 5 from last year. And right now we have 3 pending cases. But as Jim will tell you, there's only 1. 2 came in this week. We couldn't get included in the report. Jim will talk about that. In his cases. Going to talk a little bit about the COVID cases, which everybody is talking about these days. As I said, we had a total of 116. Out of those 116, the majority of those cases were above the age of 70. What did I say? 101 were above age 70. So as you can see, it's hitting the overpopulation. The ages range from 45. We had 1 case in that age group, and then all the way up to, like I said, the age of over 100. But the majority of them are over the age of 70. And they
comorbidity, Jeff. Dr. Comorbidity.
Yes. Yeah, all these cases really, most of the older people with the comorbidities, they get COVID and they die from their comorbidities. But we investigate, just to let you know, we investigated every COVID case that came through the nursing homes, the hospital, or the funeral homes where they picked them up at home. So the numbers we give here are rarely accurate and true numbers of true COVID cases. The state, on the other hand, I won't get into that, but our numbers and the state's numbers will differ. Every case was investigated by our office to prove was it COVID or wasn't it COVID. So we have very accurate numbers for the COVID cases. So that's my report. Do we want to go with Holly and Jim and then come back and ask questions?
That's fine.
And go.
Yes. Yep.
I'm going to let Jim sit here now.
Good morning.
Good morning.
I'm going to report today on the overdose death numbers for 2020. Like Dr. Yocum said, his report that he gave earlier was not completed, and we got some in at the last minute. For 2020, we had a total of 39 confirmed overdose deaths through the use of drug or alcohol. Just to remind you, last year, 2019, we had 28 deaths. So this number of increase in our overdose death numbers. I'm going to break down some statistics for you so you get a full picture of what's going on in Lebanon County. Gender-wise, we had 27 males and we had 12 females. The ages range from the oldest being 60 to the youngest, average age of 38.8 years old. Broken down by race, Caucasian, it was 26 cases, Hispanic, 11 cases, and unknown or other 2 cases. We also broke down the deaths according to months throughout the year. I'd like to read them off. In January, we had 3 cases. In February, we had 4. In March, we didn't have any cases at all, and we all know that was the start of this COVID pandemic. That was obviously the lowest in March of 0. And then it started picking up. In April, we had 3. In May, we saw our highest month of 8. In June, we had 4. July, we had 5. August, we had 6. And then in September, we saw the numbers going down again. September, we had 1. October, we had 1. November, we had 2. And December, we had 2. For the total of 39 for the whole year. We also, this year, as a recommendation last year when Dr. Yocum and myself were there for the meeting in person, there was someone that asked a question. We normally list the addresses of where the people resided, and someone that was at the meeting last year thought it was a good idea if we actually listed the zip codes where the person died. So this year, not only did we collect their addresses where they resided, but we also collected the information for where the death occurred. So we have a breakdown, and we did it by zip codes. So in the 17042, we had 14 deaths. In the 17046, we had 13. In the 17067, which is Myerstown, we had 5. In 17078, we had 3, which is Palmyra. In 17038, we had 2, which is Jonestown. We had 1 in Newmanstown, and we had 1 in Anvil, for the total of 39. The reason we decided, Dr. Yocum, again, provides us with the person's name and their home address, and also provides us with the zip code of death, because we, along with GIS, created a mapping system that people can go online and see, and they can access this information. But it basically shows on a map where most of these overdoses are occurring. What that does for us, personally, our office, we can target problem areas, so to speak, I guess, where we can provide more treatment opportunities and prevention opportunities in those areas. The other thing that's important to point out, when looking over the list of 39 people, 25 out of 39 had the presence of fentanyl in their system, which accounts for 64% of all the overdose cases in Lebanon County. So fentanyl continues to be a common substance that is found in most of these overdose death folks. So again, not happy about the increase, obviously. One's too many. 39 is absolutely way too much. And it's the highest number that we've had in Lebanon County since I've been here, and I'm not sure since anybody else before me was here. So what we've done is we are focused, our office is focused. We've been in contact with the Department of Health at the state level. I've been in contact with DDAP, who oversees the SCAs throughout the state, and we've come up with some strategies and some efforts to try to at least level off this number. We don't want to see it continually increase. So there are some action plans that are being put in place. Just to give you some examples, we are currently working on improving our warm handoff procedures at the emergency room at the Good Samaritan Hospital. In doing so, we are adding a CRS, which is a certified recovery specialist, to the hospital. We are also increasing the distribution of Narcan into the community. We're providing it to the public, to schools, first responders, law enforcement, treatment providers, prevention providers, as well as county agencies, probation and parole. We're providing it at the prison. We actually have some here on hand at drug and alcohol. So we're trying to distribute that as much as we can. We're also trying to increase our heroin task force activities, which have been hard over the past year because of the COVID situation. We had some events planned, some education and awareness events, as well as Narcan distribution events, and our recovery day was canceled. So there's a lot of things that we had planned for 2000 canceled, and we're hoping that we can get back to doing some of those things in the future. And the other thing our office is trying to do is we're trying to promote the increased use of MAT, which is medically assisted treatment, medications, along with treatment. So we're trying to provide more Vivitrol, buprenorphine, and methadone for clients who are struggling with addiction and recovery type situations, to make that more accessible to folks. And there's other efforts that we're doing that I didn't write down, to be honest with you. Those were the four that came to mind. There's a lot more going on, but those are the things that I wanted to highlight today for you all. And if you have any questions on anything that I provided, any follow-up questions to the information, I'd be more than happy to answer any of your questions.
Okay, well, let's go to Holly, and from your perspective, and then we can ask questions.
Very good. Well, good morning. My name is Holly Leahy, Administrator for Lebanon County Mental Health, Intellectual Disabilities, Early Intervention Programs. So I'll be providing details on the completed suicides for calendar year 2020. As Dr. Yocum indicated, there were 21 completed suicides during 2020. That was a total of 14 males and 7 females. And I will say that this year was quite notable for the amount of females. On average, we have perhaps 1 or 2 females per year. So 7 out of the 21, or 33%, is a huge number for Lebanon County. So very concerning for us. All of them, well, 20 were Caucasian and 1 Hispanic, so primarily Caucasian individuals are completing suicide, and by the overwhelming method of firearm, 12 out of the 21 by firearm. And it's interesting to note that only 9 of those individuals had a known mental health history and were receiving services, so that's pretty notable. When we look at the age of the individuals, it's an average age of 52.7 years of age. The youngest was 20 years old, and the oldest 89 years old. So those are the statistics, and that was 2 additional completed suicides, so up 2 from last year. We had 19 completed suicides last year. A little bit with regard to our suicide prevention task force, which is very active within our county, meets on a monthly basis. The efforts that transpired last year, we have an ongoing media campaign, and that happens throughout the whole entire year. Through federal CARES Act funding, we were able to do some extra media and marketing campaign efforts during 2020. We had virtual training opportunities, so they were virtual because of COVID-19. Those training opportunities included mental health first aid, as well as QPR, suicide prevention training, which stands for Question, Persuade, Refer, suicide prevention training. Also, through federal CARES Act funding, we were able to fund for outpatient therapy for individuals that wouldn't normally be able to access county funding. Normally, folks must have a diagnosis of serious mental illness in order to access that. So it was a wonderful opportunity to assist individuals that didn't meet that criteria. Our suicide prevention task force continues to meet on a monthly basis, and we hope to really ramp up those efforts even more in 2021. We know that those numbers did increase a little bit, so very concerning to us, and we'd love to do more, hopefully in a safe environment.
Thank you, Holly.
I have a question. Commissioner Litz, if you have a question, I'll defer first. I'm not sure how to frame this exactly, but with the 39 being the highest ever number, I'm just wondering, we have hotlines on several levels throughout the county for people to call for help. Is there any, are there any numbers on successful interventions, or, if those numbers are going way up, can you tell if we've done a good job in intervening to a greater extent than usual because of the COVID? When you have a 100-year pandemic, and you have the isolation, and you have the increased stress within the families, I know PFA requests are way up over last year, the year before. So you have all those things going on in our county, and I'm wondering if if there's any data on successful preventions that you'd say, well, gee, our numbers are up in this area, but we've saved far more because of the volume that we're dealing with. That's kind of a general question for both, maybe Holly and Jim.
I mean, I could speak to a little bit about that. I know people, from our perspective, people are we have what we call PA Help Now initiative, which is statewide. People are calling that number, and we are interacting with a lot of folks through that number, through that connection. And people are getting treatment. People are getting into treatments they need. I can only assume they're getting the help, but I don't get statistics back from PA Help Now. I assume people are also using 211, that system locally, but again, I don't get statistics from United Way about who's utilizing it, where the calls are going, and what calls are successful and which ones aren't.
Well, we have crisis intervention, DVI has a hotline, SARC has a hotline, so there's a lot of opportunity for people to get help, and I'm just wondering if anybody's tracking the volumes on those things to see how they relate to percentages of outcomes, So.
And we do, Commissioner, both me and Holly contract with crisis intervention. So me and Holly are fully aware of how many people are showing up at the ER for either mental health treatment or drug and alcohol treatment, or sometimes with the folks we deal with, both.
Yes.
So we are well aware. I think off the top of my head, Holly could correct me if I'm wrong, I think there was like 2,200 people seen at the ER last year in 2020. Some were Holly's people, some were my people. So we do have a handle on those folks.
Yeah, and that would be a good number to compare to 19, I guess, is what I'm kind of asking.
Okay.
How much the COVID impacted on those kind of things.
Right. And we also, from our office, we also have a warm handoff protocol in place at the hospital. And Brenda Startoni of Crisis Intervention is heavily involved in that. So we do have numbers around that as well.
Very good.
I guess the bottom line is we are helping more than, we do report 39 deaths today. However, we've been in contact and have helped far more than 39 people.
Oh, yes. Yep. Commissioner Litz, you had a question.
Really, I was going to draw your attention to a hand up from Laura LeBeau.
Oh. Would you like to bring Laura in for a question? All right, Laura, if you unmute, you'll be ready to go.
You're on mute, Laura.
Sometimes goes into
There she is.
Okay, are you there?
Yep.
We are.
Okay.
Yeah, we're here.
Hi, thank you. I'm here. I did have two questions, one for Holly and one for Jim. Holly, you mentioned that 7 female completed suicides, extraordinarily, high number, unfortunately. You also mentioned that 12 of the 21 suicides were completed with a firearm. Were women? I don't know if you can explain this, but did women use firearms in the completion of their suicides more or to some extent?
Actually, no, it's kind of unusual for women to complete suicide by firearm. 1 out of the 7 did complete by firearm. The others, it's more common for drowning or hanging or carbon monoxide for females is more the typical method of completion.
Okay, thank you. And for Jim, my question was, Jim, you had mentioned that one of the things that your department is trying to do is increasing Narcan access in the community. And almost to the same extent of what Commissioner Phillips was just saying, do we have any kind of tracking as to whether that availability in the community has been successful? Do you have any idea how many people have been saved with having access to Narcan?
I can speak on being a distributor of Narcan. I know where the Narcan's going into the community. In return, if the Narcan's used in the community, I get a report back from whoever used the Narcan. Or if they need to refill a request for more Narcan, they have to provide me with information on, it was used. Whether it's successful, I don't have the statistics for that. EMT, I'm sure, with all the Narcan they probably use, they would be able to statistically more factual than I could.
Okay, thank you.
And Commissioner Phillips, just to give a little more information about crisis intervention to add on to what Jim reported. So there were approximately a little over 2,200 individuals seen at crisis intervention. Now that was for fiscal year 1920, so that would have been from July 1 of 2019 through June 30th of 2020. We can tell you that for the previous fiscal year 18-19, there was a little over 2,000. So it was up a little bit by 200 individuals. But we can tell you that overwhelmingly, the reports of suicidal ideation have greatly increased. And so the amount of individuals going into crisis intervention for suicidal ideation is up statistically. And we're definitely addressing that much more frequently overall.
Well, I think with the timing of the pandemic, it might be better to compare calendar years than fiscal. That might give you a better picture of the impact. Anything else? Here comes Dr. Yocum.
Just to comment on a couple of things. Bob, Bob and I, he gave my telephone calls because we were in constant contact with this COVID crisis. I think he might be able to comment on a couple of things from the COVID crisis that we tracked through the year. Also, and Holly, we didn't get to talk about this, but this year we saw the drug-related deaths from COVID. I honestly think this coming year, suicides are going to be up because of COVID. The mental health issues I'm seeing in the office is astronomical. people that are usually very calm, sedate people are over the edge. They don't know what to do. They've been locked up for a year. They can't do anything. Family problems. I'm just worried that that's what we're going to see this year. The drug and alcohol, I think, is going to get better, and I think the suicides are going to go up. I hope I'm wrong, but I'm just seeing it in my office personally, and it concerns me. The COVID crisis, I think the numbers that I'm seeing in my office are decreasing. The numbers coming from the nursing homes are decreasing, and they're all getting their vaccines, so I think we're getting that under control. And the COVID crisis we're going to be addressing shortly with some vaccination, new opening of places where they can get vaccines. Now it's very limited, so hopefully in the future, Bob can talk about this a little bit. We'll be opening some more centers to get vaccines. But again, I want to thank Bob and Jim and Holly, always accepting my calls, even though they really don't want to hear what I have to say a lot of times. But here again, I stress the cooperation we have in this community with our health, with our officials, is excellent. I mean, you couldn't get a better county to work in. And I appreciate you and the public for giving me the chance to serve as the coroner.
All right, Jeff. Dr. Yocum, thank you so much for your service to our county as well.
Thank you.
And I just take a moment, if you, Bob Dowd, if you'd like to give an update to tie in with the coroner's remarks.
Yeah, really the one thing I want to add is some context to the death count that Dr. Yocum's reporting for COVID deaths. And Dr. Yocum, correct me if I say anything wrong here. The visibility, though, is limited to cases where the person actually died in Lebanon County or Lebanon County facility. So there could be, for example, somebody who uses Hershey Med as their primary health care, and they died in Dauphin County. They're a Lebanon County resident. We would not have visibility into that. Yocum would not be able to give you any information on those types of deaths. Is that correct, Yocum?
Correct. Yep.
So I just want to make sure that context is known with that number, so it's not a complete picture of the deaths that did occur in Lebanon County for COVID. Otherwise, along the same lines with what Dr. Yocum was just saying, we're working very hard to formalize some large-scale vaccine plans. That really is the light at the end of the tunnel for this pandemic, and the bottleneck at this point, and it's going to continue to be the bottleneck for the next several months, is just vaccine supply. We can turn on everything now, but we don't have the vaccine to give yet. So as those supply chains start to open up, we'll be able to greatly increase the number of people that are vaccinated on a weekly basis in the county.
And the word for the public is to just see as many places that you can register, and then whoever responds first. Is that still the protocol you're suggesting?
So right now, the state is still officially in the 1A phase of vaccine distribution, which is healthcare workers, and then all those 65 and older, and those between the ages of 16 and 64 with a certain subset of underlying conditions. If you are a healthcare worker, you can register through us to get vaccinated, or through any of the providers that are currently offering it. If you are a general member of the public who falls into that age risk category or underlying condition risk category, you need to go right to a vaccine provider. And currently in Lebanon County, that's Wellspan, Welsh Mountain, Wise pharmacies. I believe there are 2 of them. And I believe there's a Rite Aid pharmacy coming online. Yeah. All of those locations can be found on the state website. But I do want to stress that the website that we put up is specific for those frontline workers at this point, specific for healthcare workers in 1A. So everybody else, managing expectations is important here. This is a bit of a waiting game. When the state changed the plan 2 weeks ago, that put 30,000 people by our estimates just in the age alone category into 1A. You take that and look at the fact that Lebanon County is getting 2,500 doses a week, and half of those are now going to second doses. The bandwidth is just not there. Now it's going to increase, but right now it's just not there. And it's going to be weeks, if not months, until we were able to get through just that 1A section.
Very good update, Robert. Thank you. Anything else from our medical team, or any questions?
I'd just like to thank all of them for the thorough report. People, I think, can handle the truth, but not knowing is as stressful and plays on mental health as well. So thank you for all of your time and thoroughness in bringing this to light.
Thank you.
All right, Dr. Yocum, thank you again.
Thank you.
Jim Dunmoyer and Holly Leahy, thank you all. And Robert Dowd.
Thanks.
We can keep, let's keep